Hi, my name is Gregory Low. I'm one of the colorectal surgeons at the University of Tennessee Medical Center here in Knoxville. I wanted to take a few minutes today to talk to you about colorectal cancer. As you may or may not be aware, March is Colorectal Cancer Awareness Month. And so we really wanted to highlight the importance of colorectal cancer screening and some of the novel treatment approaches we have here at the University of Tennessee Medical Center. So colorectal cancer is the second most common cause of cancer-related death in the United States. Estimates for the coming year for colorectal cancer show there will be about 100,000 cases of colon cancer and 50,000 cases of rectal cancer diagnosed this year in the United States. The lifetime risk for individuals is about 1 in 25. So you can understand why this is of vital importance for both the local Knoxville area and patients across the country. Fortunately, the incidence of colorectal cancer for those over the age of 50 has been decreasing over the last 10 to 15 years. Now, for younger patients, those under the age of 50, that incidence is going up at a rate of about 2% per year. There are a number of people across the country that are looking into why this might be, but some of the things that have been considered are that's below the traditional age for screening in the United States. It had historically been starting at age 50. And a lot of it has to do with lifestyle factors, increasing rates of obesity, poor dietary habits, and sedentary lifestyle in our country, among others across the globe. So colorectal cancer has a wide variety of presentations. Patients may be 100% asymptomatic and diagnosed on a routine colonoscopy. They might have a change in their bowel habits. They might notice blood in their stool or weight loss, things like this. And any of these symptoms typically prompt a workup. But our hope is obviously to catch it before it develops into a rectal cancer. And so that's where screening comes into play. When we're talking about screening for colon cancer, most traditionally we're talking about colonoscopy. That's been the gold standard in our country for some time, but there are a number of different other screening modalities which we'll talk a little bit about in a few minutes. The most important thing that I can stress to people is that screening for colorectal cancer saves lives. For people that are up to date on their colonoscopy, you can decrease the risk of colorectal cancer, sigmoidoscopy, fecal immunohistochemistry testing, and CT colonography. The most important thing is that you're getting some sort of screening study as determined by your primary physician. Now, treatment options have really come a long way in recent years. Here at the University of Tennessee Medical Center, it is a collaborative approach between colorectal surgeons, surgical oncologists, medical oncologists, radiation oncologists, and geneticists, among many others involved in the care of colon and rectal cancer patients. We have a number of new novel treatment options available, from chemotherapy, immunotherapy, and novel surgical techniques such as endoluminal surgery options, minimally invasive options such as robotic surgery and laparoscopic surgery, and even non-operative management for some patients with rectal cancer. And so these things are all on the cutting edge of colon and rectal cancer treatment in our country, and are options for patients that are being treated at our institution. What many of you are probably wondering is, what can you do to decrease your risk for colon and rectal cancer? The most important thing, like we talked about, is screening, but maintaining a healthy lifestyle with lots of physical activity, smoking cessation, decreased alcohol intake, and healthy, high-fiber diets with lots of fruits and vegetables are also things that we know can help decrease the risk of colon and rectal cancer in our patients. I hope today this short introduction to colorectal cancer helped answer some of your questions regarding this very prevalent disease. As a reminder, tomorrow is Wear Blue Day as part of the Colorectal Cancer Awareness Month. So for anyone that wants to show their support, we encourage you to wear blue tomorrow.